Over the past several weeks in this series, we have covered 6 different things that happen to your legs after 60, the nerve signal that misfires at 3 a.m., what blood pressure medications may be doing to your leg nerves over years, the lymphatic drainage system that fails every afternoon, what restless legs are warning you about, the vagus nerve and the stress magnesium cycle, why one leg swells more than the other. 6 conditions, 6 different systems, 6 different explanations. And across all 6, I kept pointing towards something I had not yet shown you. A single upstream factor that influences your nerve health, your inflammation levels, your lymphatic function, and the stress response that drains your leg muscles of the minerals they need. Today is that video. If you are finding this channel for the first time, this video stands completely on its own. But if you have been watching this series, this is the one it has been building toward. I want to tell you about a patient I'll call Frances. She was 67 years old. She had been diagnosed with peripheral neuropathy. The burning, tingling, sometimes numb sensation in her feet and lower legs that had been getting worse over the previous 2 years. Her doctor had prescribed a medication to manage the nerve pain, which helped somewhat. But the underlying neuropathy continued to progress. No one had mentioned diet. No one had mentioned her gut. No one had drawn any connection between what she ate every day and what was happening in the nerves of her legs. When Frances began working with a practitioner who looked at gut health specifically, she made 3 changes to what she ate. Consistent changes, sustained over about 3 months. Her tingling symptoms reduced noticeably. A follow-up nerve conduction study 6 months later showed this modest but measurable improvement in nerve function. I want to be precise about this. Frances did not cure her neuropathy. What she did was shift the conditions inside her body that were allowing it to worsen. She changed the environment her nerves were living in, and the mechanism behind that, the way food reaches the nerves in your legs, is what I want to show you today. Because your gut and your leg nerves are connected more directly than most people realize. And the connection involves something your body produces inside your intestines from the food you eat, a molecule so important to nerve health that researchers now consider it one of the primary regulators of peripheral nerve integrity. When you eat dietary fiber, the kind found in vegetables, legumes, oats, fruit, and whole grains, the bacteria in your large intestine ferment it. They break it down and produce, as a byproduct, a family of compounds called short-chain fatty acids. The 3 main ones are acetate, propionate, and butyrate. Of the 3, butyrate has drawn the most significant research attention in the context of nerve health. 2024 study published in a peer-reviewed microbiology journal found that gut microbiota directly regulate peripheral nerve development and the integrity of the myelin sheath, the protective coating around every nerve fiber that allows signals to travel cleanly and at full speed. The researchers found that when butyrate-producing bacteria were absent, myelination was impaired, and that butyrate supplementation restored it. Research published in Frontiers in Neuroscience confirmed the wider picture. Short-chain fatty acids produced by gut bacteria exert crucial physiological effects on the nervous system, and emerging data now link gut microbiota composition to peripheral neuropathy outcomes through this pathway. A separate analysis in the journal Microbiome found that both fecal transplantation and butyrate administration improved neuropathic pain and nerve. Survival in animal models? What that means in plain language is this. The bacteria in your gut, fed by what you eat, produce compounds that directly maintain the health and insulation of the nerves in your legs. When those bacteria thrive, your peripheral nerves receive the chemical environment they need to function and repair. When those bacteria decline, the compounds that protect your nerve myelin fall with them, and the nerves become more vulnerable to the inflammation, compression, and electrolyte disruption that causes the symptoms we have covered throughout this series. Your gut does not just digest food, it actively protects the nerves in your legs through what it produces. And here is what makes this especially important for anyone over 60. Because the gut microbiome does not stay the same throughout your life. Something specific and significant happens to it after 60, and the consequences run directly into the leg symptoms this series has been covering. Multiple published reviews, including a 2025 synthesis in Science Direct and a 2026 analysis in TanFOnline, have confirmed the same pattern. As we age, gut microbial diversity declines, the composition shifts. And the direction of that shift is consistently away from the bacteria that protect us and toward the bacteria that harm us. Specifically, beneficial bacteria, particularly Bifidobacterium and Lactobacillus, which produce anti-inflammatory compounds and support gut barrier integrity, decline measurably in older adults. At the same time, pro-inflammatory species increase. For women, this shift accelerates after menopause. A 2025 review confirmed that postmenopausal estrogen decline is directly associated with loss of Lactobacillus species and enrichment of pro-inflammatory gut bacteria, creating a compounded disadvantage where hormonal change and microbial change reinforce each other. The critical consequence: when Bifidobacterium and Lactobacillus decline, short-chain fatty acid production falls with them. Less butyrate is produced. Less of the molecule that maintains peripheral nerve myelin circulates through the system. And there is something else in this shift that connects directly to what this series has already covered. 2026 TanFOnline review notes that the decline in beneficial gut bacteria after 60 is also linked to a measurable decrease in the gut's production of B vitamins, including thiamine. In an earlier video in this series, we talked about how diuretic medications deplete thiamine and how that depletion damages leg nerve myelin. The gut's declining capacity to produce B vitamins after 60 compounds that same effect, creating two separate pathways to the same nerve. Vulnerability. If you have been watching this series, that connection should feel significant. Your gut is not failing you by accident. It is aging just as every other system in the body ages. But unlike many of those systems, the gut microbiome is one of the most responsive to dietary change. Clinical studies show that meaningful shifts in its composition can begin within days to weeks of consistent changes in what you eat. And that responsiveness is what makes this video the most practically actionable in the series. But before I show you what to eat, I want to close the mechanism loop because understanding exactly how gut dysbiosis reaches your peripheral nerves is what makes the dietary strategies make sense as medicines, not just as general wellness advice. When beneficial gut bacteria decline and the gut lining becomes less healthy, something researchers call intestinal permeability increases. Small gaps develop in the gut wall. Bacterial byproducts that in a healthy gut would stay contained inside the intestine begin crossing into the bloodstream. The immune system responds. Inflammatory signaling molecules, including TNF-alpha and interleukin-6, are released into systemic circulation. This is not the acute inflammation of a healing injury. It is low-grade, persistent, chronic inflammation. Researchers call it inflammaging. Inflammaging damages peripheral nerves. TNF-alpha and interleukin-6 are directly toxic to myelin, the same protective coating that butyrate works to maintain. Chronic systemic inflammation strips insulation from peripheral nerve fibers the way acid slowly corrodes a wire coating. The nerves continue to function for a while, but they become more vulnerable, more prone to misfiring, and less able to conduct clean signals. The result is the tingling, burning, numbness, and cramping we have been discussing across this entire series. And this chain, from gut dysbiosis to weakened gut barrier to systemic inflammation to peripheral nerve damage, is not fixed. It is not irreversible. The gut microbiome is one of the most modifiable systems in the human body. And those modifications translate through the butyrate pathway and through reduced inflammation into better conditions for your peripheral nerves. That is what Francis changed. Here is exactly how. The first strategy I'm about to show you produced results so surprising that the lead researcher at Stanford University used one word to describe them in a published statement, a word scientists almost never use about their own data. That word was stunning. Here is what caused it. The first strategy, fermented foods every day. A clinical trial at Stanford assigned 36 healthy adults to one of two diets. One high in fermented foods, one high in dietary fiber. The fermented food group ate yogurt, kefir, fermented cottage cheese, kimchi, other fermented vegetables, and kombucha. The fermented food diet produced a significant and measurable increase in overall microbiome diversity. It also reduced 4 specific types of immune cell activation, meaning systemic inflammation measurably fell. Lead researcher, Professor Justin Sonnenberg, stated, "It was one of the first examples of how a simple dietary change could reproducibly reshape the gut microbiome across a cohort of healthy adults." That was the finding he called stunning. Not an incremental shift, a reproducible remodeling of the microbiome from a change most people could make at breakfast. Stronger effects came from larger daily servings, but even one serving of fermented food daily produced measurable change. The practical version is straightforward. One serving of plain live culture yogurt at breakfast. A small portion of kimchi or sauerkraut alongside lunch or dinner, both widely available and expensive. Kefir in place of regular milk. These are not dietary overhauls. They are small additions that seed the gut with live beneficial organisms and consistently drive diversity upward. This was the first change Frances made. Plain yogurt every morning, kimchi with her evening meal, consistent, not perfect, but daily. The second strategy, feed the bacteria that produce butyrate. Fermented foods introduce beneficial bacteria, but those bacteria need to eat. What they eat, what produces the butyrate that protects your peripheral nerve myelin, is a specific type of dietary fiber called prebiotic fiber. Prebiotic fiber passes through your stomach and small intestine undigested and arrives intact in the large intestine, where bacteria ferment it into short-chain fatty acids. No fiber, no fermentation, no butyrate. And with no butyrate, the myelin protection pathway has nothing to run on. The best sources: garlic and onions, which contain inulin, one of the most studied prebiotic fibers. Oats and barley. Cooked and cooled potatoes, which develop resistant starch as they cool. Bananas, particularly slightly underripe ones. Legumes, lentils, chickpeas, black beans, among the highest fiber whole foods available. Asparagus, leeks, and chicory. The NUAGE study, a one-year dietary intervention conducted across 5 European countries, specifically in elderly participants, found that a Mediterranean-style diet rich in fiber and polyphenols significantly increased Bifidobacterium, Faecalibacterium, and Roseburia, 3 of the major butyrate-producing bacterial species. At the same time, it decreased C-reactive protein and interleukin-17, 2 of the primary inflammatory markers involved in peripheral nerve damage. 1 year, 5 countries. Measurable improvement in the gut's protective capacity and measurable reduction in the inflammatory compounds that damage peripheral nerve myelin. That is the research behind the second strategy. Most people over 60 eat roughly 12 to 15 grams of fiber daily. The recommended amount is 25 to 30 grams, closing that gap through legumes, oats, vegetables, and the prebiotic foods above is the most direct nutritional pathway to increasing butyrate production in your gut. Frances added a portion of lentils or chickpeas to her meals 3 or 4 times a week. Garlic into her cooking every day. Oats at weekends, small, sustainable additions, not a nutrition plan, a consistent shift. The third strategy is the one that does not have one landmark trial behind it. The way the first 2 do, it has dozens of smaller studies, several major meta-analyses, and the consistent observation of virtually every gut microbiome researcher working in this field. And it may matter more than either of the first 2 strategies, because it is not about adding something. It is about stopping something that is actively working against everything the first 2 are trying to build. Reduce ultra-processed foods. Ultra-processed foods? Packaged snacks, white bread, processed deli meats, most fast food, sugary drinks, ready meals with long ingredient lists are consistently associated across the literature with reduced gut microbiome diversity. They tend to feed the pro-inflammatory bacterial species that drive inflammaging while providing almost nothing for the beneficial SCFA-producing bacteria that protect nerve myelin. The mechanism runs through the gut barrier. Ultra-processed foods are typically low in fiber, high in wine sugars, and contain emulsifiers and additives that multiple studies have shown to disrupt the integrity of the gut lining. The same barrier whose breakdown sets the inflammaging chain into motion. You can eat the best prebiotic fiber in the morning and then spend the rest of the day-feeding the bacteria that undo its effect. Which is why this strategy, while supported by less dramatic clinical data, is the foundational one. You cannot build the conditions your peripheral nerves need in a gut that is being continuously disrupted. Frances did not overhaul her meals. She made one substitution. She replaced the packaged crackers and processed snacks. She reached for daily with whole food alternatives. Oat cakes, handful of nuts, hummus, fruit. That single consistent change reduced her ultra-processed food intake significantly without requiring her to rethink how she cooked or what she ate at mealtimes. Small, consistent changes compound. The gut microbiome responds to what it receives every day. Not to perfect weeks, followed by lapsed ones, but to a consistent daily shift in the direction it is being given. Let me bring this together, the practical summary and the larger picture of what this series has been trying to show you from the very first video. 3 strategies backed by clinical evidence. 1. Add fermented foods every day, at least 1 serving. Yogurt, kefir, kimchi, sauerkraut. These directly seed your gut with live beneficial organisms and measurably increase microbial diversity. The Stanford data calls the effect reproducible. That word matters. 2. Increase prebiotic fiber to feed the butyrate-producing bacteria your peripheral nerve myelin depends on. Garlic, onions, oats, legumes, cooked and cooled potatoes, bananas. Aim to close the gap between the 12 to 15 grams most seniors eat and the 25 to 30 grams the research supports. 3. Reduce ultra-processed foods, not because one single study proves it dramatically, but because the consistent weight of evidence across the entire field of gut microbiome research says it is what the first 2 strategies need in order to actually work. You cannot seed a garden that something else is continuously poisoning. And here is the larger picture. Every video in this series pointed to something real happening in your legs and then showed you that the cause ran deeper than the leg itself, deeper than the muscle, deeper than the nerve, down to the systems that regulate inflammation, protect myelin, maintain electrolytes, and determine how resilient your nervous system is when it comes under pressure. The gut sits at the root of most of those systems, produces the butyrate that protects nerve myelin. It houses the bacteria that manufacture the B vitamins your nerve fibers depend on. It regulates the inflammatory tone that either damages or spares your peripheral nerves. And it does all of this through what you give it 3 times a day. Frances described it this way. She said, I had spent 2 years being told what was wrong with my legs. Nobody had ever asked me what I was eating. I hope this series has been the answer to that question. Drop a comment and tell me, which video in this series surprised you most? I read every single one, and knowing which topics land hardest helps me build what comes next for this community. If someone you care about is dealing with leg symptoms that have never been properly explained, please share this series with them. Starting from the first video, each one builds on what came before, and the full picture is worth more than any single part. Before you go, this series has covered 7 connected topics: the 3 a.m. nerve cramp, blood pressure medications and leg nerves, the lymphatic system failing every afternoon, what restless legs are warning you about, the vagus nerve and the stress magnesium cycle, why one leg swells more than the other. And today, the gut-leg connection that ties it all together. But there is one angle we have not approached yet, and it is one that the 2025 research on the gut microbiome has brought into sharp focus: sleep. Not just sleep and leg cramps, which we covered at the start of this series, but sleep as a system. The way the architecture of your sleep determines how well your gut microbiome recovers overnight, how your nervous system repairs peripheral nerve damage, and how the lymphatic system in your brain clears the inflammatory waste that accumulates during the day and reaches your leg nerves by morning. In the next video, I am going to show you what happens in your body specifically between the hours of 11 p.m. and 3 a.m. and why what happens in those 4 hours has more influence on your leg health the following day than almost any other factor this series has discussed. Subscribe, because the sleep video completes the picture, and it may be the one that finally explains why some mornings your legs feel completely different from others, even when you have done nothing differently.